Hello and welcome back to the National Cancer Prevention Workshop, sponsored and produced by lesscancer.org. I'm Miles O'Brien, the chairman of the board of that organization, and we're continuing a series of conversations we're doing this year called the John Dingle Cancer Health Disparities and Access Interviews. And we're looking at disparities in healthcare and how that impacts occurrences of cancer and mortality as well. And also broader themes of disparities in health, which brings us to our guest on this segment. Dr. Mona Hanna-Attisha is a pediatrician and professor at Michigan State University. And you may recognize her name as she is the person who blew the lid off of the scandal of Flint's water supply in late 2014 and the lead that was in it, causing untold consequences to this day, really, in that city. And Mona, first of all, thank you for your time.
Miles, it is great to be here with you and to celebrate this important week.
Yeah, this is an important week. And, we're talking about cancer prevention, but we're also just talking about disparities in health. And, I think it's worth, I want to talk about what's going on now, but just to refresh people, you a pediatrician in Flint, Michigan, and you had talking to patients. They were wondering why the water tasted funny, smelled funny. And at first you were like, oh gosh, they would never put bad water in our taps. And then you have a conversation with somebody who says, actually there's a real problem here. They've switched the supply, there's corrosion, and there's lead in the water. And the minute any healthcare professional hears the word lead in water, that sends up a whole bunch of alarm bells. And you literally marched out in front of a news conference long before there's no time for peer review, and you spilled the beans on this. And just remind people what transpired after that. You went through. There's a very long story, and I encourage you to, by the way, read the book on this, which you penned, called "What the Eyes Don't See." It's reads like a Grisham novel, except it's true. What happened after you spilled the beans on that?
Yeah, so I, as a pediatrician, like you said, when I heard lead, I freaked out and I did the research to see what was going on. And not surprisingly, there was a lot of lead in our water and there was more lead in our kids. So spilled the beans, shared that research very publicly at a press conference. And what happened after that was unexpected for me, because here I am just sharing science, right? And can you imagine being in the middle of a public health crisis and not listening to science? So that was a joke.
I'm shocked that there's gambling in this establishment. Really?
Believe it. I'm just sharing science and I'm just protecting kids. And the science is super clear that there is more lead in kids. And that's not what people wanted to hear. And so often when we are trying to protect children, when we're trying to really have policies reflect science, we're often shut down. And there's this kind of huge time lag between making sure we do put into place policies and we do take action that respects science. So my science was attacked, but we persisted, which is, the story of so many scientists and advocates over time. And finally, the state conceded, recognized there was a problem. And since then, I have been really privileged to work on Flint's recovery, trying to eliminate these disparities, trying to limit the impact of this, not only population level lead exposure, but really a population level trauma.
Well, all right. Before we get into that and what's going on now, I just a couple of words on the fact that it wasn't an attack per se on your data. It was really a personal attack. And I do think that during the pandemic, you must have seen some parallels to all this. I'm just curious what your thoughts were as you saw the science being discredited in the context of COVID-19.
Yeah. And I see a silver lining here. And I'm also this eternal optimist. So, the lessons of Flint are the lessons of science denial, of kind of the consequences of disinvesting in public health infrastructure and kind of what keeps people healthy. It's a story about inequities, which we also saw. And these were the same kind of stories that that the pandemic taught us. And there's folks who've read my book recently and they're like, oh my gosh, did you know there was going to be a pandemic when you wrote this book?
Yeah.
No, I couldn't have predicted there was a pandemic, but these are long-standing issues where as a nation we tend to be really reactive to crises, and we fail to prevent crises. And it's also, this acknowledgement that not everybody bears the same burden when it comes to these inequities and these crises, especially in the environmental world, also very much in the cancer world. So lots of the same lessons. And for me, that provides me kind of this opportunity of hope. For a long time after Flint, we were encouraging kind of our nation to invest in public health, invest in infrastructure, highlight the role of inequities and disparities. And now that's a global lesson where we all hopefully are recognizing that, hey, we need to spend more money on keeping people healthy rather than on healthcare, which is so much of a sickness-based system. And we need to, invest in infrastructure and invest in our local health departments and also recognize kind of this role of inequities and who bears burdens. So there's a silver lining here, lots of the same lessons that continue to repeat. And I'm hoping that we once again can pause and reflect and learn from history so that we don't keep repeating these same lessons.
Yeah, it's and I know it's good to maintain your optimism, but it does get tested quite a bit. And when you look at the lack of investment, not just infrastructure, but public health, let's talk about public health here, and the lack, and what that says is exactly what you were saying, that we don't want to spend money on prevention. And is that human nature or is that something that is unique to the United States? I feel like other countries probably do this a little bit better. And what is it about the American psyche that makes it hard to invest in a little bit of insurance before the house is burning?
Oh, this is a 3-hour conversation. So, why don't we invest in prevention? Right now my efforts are about trying to get the child tax credit expanded in Congress. And, for a minute we had this expanded child tax credit where we proactively investing in the health and development of children. And when you think about this, like this act of prevention is standard in other countries. Like we are a global anomaly when it comes to investing in prevention. And the science is clear. Our outcomes are not great. Life expectancy has been dropping the last few years. Infant mortality, disparity, all these other disparities in chronic diseases. We're not doing very good as a nation because we're not investing in public health. Healthcare, as I mentioned before, is very much this sickness-based system. It's reactive. We poured millions and millions of dollars into taking care of people once they're already sick, but we don't invest once again in what keeps people healthy. And it's not in that same realm as healthcare. Like keeping people healthy is things like the child tax credit. It's like raising the minimum wage. It's like universal child care. It's stronger environmental regulations that prevent cancers and so many other disparities. Those are the things that keep people healthy that we don't invest in. I've scratched my head a lot about why are we such a reactive nation when it doesn't really make us any healthier? And I think it kind of really points to special interests that are making a lot of money off of this sickness-based system, not only the healthcare industry, the pharmaceutical industry, but also the industries, be it tobacco or lead or asbestos or coal, these polluting industries that have kind of reaped profits on the backs of people, especially vulnerable people. There's a great book that I would recommend called The Triumph of Doubt by a friend and colleague, David Michaels, who's the former director of OSHA, that really kind of talks about this playbook of industry-driven playbook that has weakened our public health regulations, that has caused us to, have cut funding to public health and regulatory agencies, mainly for the bottom line of these industries. So it's really important for us to ask those why questions to get at kind of these dark money special interests that are making it really hard for us to invest in public health.
Yeah, always follow the money, I guess. And the truth is we have, on top of all of that, a healthcare system that has profit at its center.
Yes.
So you've got industry is trying to make money and getting away with polluting. And then in a healthcare industry, which, let's call it like it is, isn't unhappy to have sick people because that's the business.
Yes.
So we've really created a mess for ourselves, it seems.
Yeah. I was a quick story. I was at our children's hospital a few years ago, and the rotavirus vaccine had just come out. This prevents diarrheal diseases. Kids used to get admitted with dehydration from rotavirus. And I was at a faculty meeting, and the CEO of the hospital said, we have a big problem. The rotavirus vaccine is working and kids aren't being admitted. And so we're not making money. And I'm like, what are you talking about? Like, this is great news.
I mean, you laugh, but that's just tragic, right?
It is tragic. So we have to kind of shift the incentives of our healthcare industry. And I know this is depressing, but I'm going to come back to hope because, we can create investments in what keeps people healthy. And I'm going to share a story because I think it's a kind of a playbook for so many folks who want to create change. So for a long time, for decades, folks have been trying to invest in infrastructure and specifically get lead out of pipes. This is this was part of our story in Flint. The lead in our pipes poisoned the population, but it's not a unique story. It's an everywhere story. We have a lot of lead in our infrastructure. And this last Congress, the Infrastructure Act included the replacement of lead pipes, billions of dollars, the largest federal investment in lead and water elimination. And that's a success story. I had a chance to testify before Congress a few times about this, and I held up, and I have it with me, I held up a lead pipe, just happened to have a lead pipe here in my office. Of course, like who doesn't, right? and I shared, and it was a virtual testimony, which is good because you can't bring a lead pipe into Congress, if you remember the game Clue. But I as an optic, which is so important to be good storytellers when we're talking to policymakers, I held up how this pipe, which was one of the first pipes removed in Flint, it looks like a straw, right? And like millions of kids in America were drinking from a straw that was made out of poison that has no safe level, that has terrible impact for millions of children. And that advocacy, along with so many people, and for really decades, finally got that investment. It's not enough. We need more, in protecting children. So, this is a long game that we often have to play, to do what needs to be done, to fight special interests, to stay grounded in what's most important, which is people and their health.
So bring us up to date on Flint. And first of all, what's the situation with the water? As I say, that's still a work in progress. And I know you've got a lot of other projects underway there trying to make things better. Tell us a little bit about that as well.
Yeah, so I have all the lead pipes are here with me. Just kidding. So most of the lead pipes have been removed. We're down to like a few hundred. They have to be removed. Our water quality is absolutely better. There's huge trust issues. There's folks in Flint that no matter how good the water is, they'll never touch the water because of that betrayal. And that's really to be understood as part of the trauma of this crisis. So the water is better. My work, I run an initiative called the Pediatric Public Health Initiative, which is advocating for implementing interventions to mitigate the impact of this crisis. We're doing lots of awesome stuff. One of our biggest projects is the Flint Registry, which is funded by CDC, to follow folks who've been exposed to the water crisis, but more importantly, to get them connected to awesome things that evidence tells us promotes the health and development, especially of kids. So connecting folks to things like nutrition programs, education programs, healthcare services, trauma-informed care, medical home access. So lots of great things happening. And the beauty of our work, like I shared with the lead pipe, is that it is not focused on Flint. It is really an everywhere story. It is about making sure that we don't continue to have these same kind of problems. The last time I testified before Congress, I said, Flint's story wasn't the first, it wasn't the worst, and unfortunately, it wasn't the last. These kinds of stories continue to pop up in the news. So we have to make sure in our advocacy and our work that that we once again proactively invest in the infrastructure to make sure that kids can just be kids and be healthy rather than continuously have to kind of defend themselves against crisis after crisis.
It's got to be frustrating to you, though, to see this story repeat itself all over the nation. Why does it keep happening?
So yeah, shortly after Flint, there was a similar water crisis in New York, New Jersey, and then Benton Harbor, Michigan, another one in Michigan. And then not too long ago in Jackson, Mississippi, and they're still dealing with it. And the storylines are all very similar. They're all stories of environmental racism where, this impacted disproportionately poor minority communities. It's also stories of kind of dismissal of science and the, lack of government to respond quickly and transparently and protect the most vulnerable among us. So it is frustrating. But once again, there's also glimmers of hope because in many of these other communities where it's happened again, they've done an even better job than Flint in responding. Newark, New Jersey has already replaced their lead pipes. Benton Harbor, Michigan, in less than a year, has almost fully replaced their lead pipes. In Jackson, Mississippi, we are seeing an unprecedented response from the Department of Justice in terms of civil rights violations and holding folks accountable. So as we continue to lend and listen and support all these other communities, our hope is that they do even better than us, and they have. And I'm hopeful once again that with stronger regulations, and more investment and more national awareness, that we will have less and less of these crises, but more importantly, that we'll do better at responding.
Yes, wouldn't that be nice? There is a a component of collective trauma that we all feel about this, but it is particularly felt in communities of color. There are tremendous disparities here. These things don't happen in rich communities. And that's a simple fact. How can we address that? That gets to some very deep issues in our country.
Yeah, Miles, that's a great question. And it's a big part of the Flint story is that environmental health and justice, that what happened in Flint never would have happened in a richer or wider community. And that's not a new story. Throughout our nation, like you said, it continues to be communities of color, poor communities who are disproportionately impacted by, environmental injustice. And as we've seen in the pandemic, especially early on, disproportionately impacted by health injustice and other kind of longstanding systemic inequities. Once again, I see hope. Just a few months ago, the Environmental Protection Agency created the Office of Environmental Justice and Civil Rights with a billions of dollar budget. This is huge. This is landmark. This is another kind of big effort to amplify, especially these issues in the environmental space. We also see, progress in health. The CDC recognizes, racism as a public health issue. There's also increasing efforts at ensuring, and recognizing the role of inequities. But a lot more needs to be done. We have to tackle these issues in a systemic way, not continuing to Band-Aid them. Another lesson that we can learn from Flint, part of our recovery is the role of accountability and truth and justice. And I never thought this really pertained to me as a doctor, as a health professional. Like, people would ask me about like lawsuits and criminal charges and civil cases. And I'm like, that's none of my business. Like, I'm just taking care of people. And then I began to kind of really see it as a health issue too. When you have an injustice, it's like a wound. It's like a wound that stays open. And without some sort of restorative justice, that wound never closes and people can't heal, and they live with that trauma, which often gets passed down in generations. So, this is really important for all of us and for our nation that really has never done a good job dealing with historic injustices that have made people sick. So, I think that's an important lesson. Like, how do we reckon with bad things that have happened to people in history, so that there aren't these ongoing disparities and inequities?
What about the mental health issues that come out of this, the trauma, the depression, the PTSD, all these things you're talking about have long-lasting consequences, which are completely separate from whatever the lead might do to a young child.
Spot on. And we're seeing that in the registry. We're seeing that in other studies. We're seeing kind of the effects of PTSD, the mental health issues, and then layer the pandemic on top of that, especially for younger folks, and anxiety and depression, and also the kind of the sense of betrayal that folks out there were supposed to keep them healthy and safe, and failed. And there's this kind of severing of the social contract. So yes, we see the mental health issues acutely, which is why we've also tried to be proactive in terms of really embracing trauma-informed care and trauma-informed services, 24-hour crisis lines, destigmatizing mental health, which is really important, and providing some of this kind of proactive resources. Something else that I love to share that Flint is doing is Flint's really embraced mindfulness. We're one of the first 4 mindful cities in the country. Even our mayor has gotten like mindfulness training, and all our business leaders and our healthcare and teachers, and it started in our elementary schools as kind of this another way, another tool to address some of the mental health issues. Not enough. We need a lot more resources to be able to care for folks.
Sounds a little bit like Flintlandia, little different, a different kind of Flint. Good. I'm glad this is good. So, Mona, I got to ask you, you were a pediatrician, just kind of minding your own business, doing your job. And you really did, by virtue of discovering this and bringing it to light, put yourself on a national stage. And do you feel compelled to keep talking about these issues and marching them forward? And what do you see as some of the other challenges that you'd like to tackle?
Oh, thank you for that question. So, yes, I feel like I have been given this amazing microphone, and I'm going to hold on to it as long as I can, advocating for as many kids and communities as I can. And this is what I was trained to do. I'm still a pediatrician, still seeing kiddos in clinic. I was rounding on the floors recently with all the RSV and flu patients. So still grounded kind of in kids and taking care of them. But also recognizing that, so much of what makes children and people sick is things that we can't prescribe away. And that really we have to address these upstream determinants of health if we truly want to make people healthy. Addressing things like air quality and water quality, and childhood poverty, and racism and unemployment, and income inequality. There's these big things that make it really hard for a kid that I see in clinic to be healthy and successful. So I am blessed and privileged to continue to be able to advocate for many of these issues. The challenge that I'm working on right now is the issue of child poverty, which infects so many of our children. It is embarrassing. In Flint, our child poverty rate is over 50%. In some neighborhoods, it's 80 to 100%. And that's not okay. And that's also not unique to our community. That's throughout this nation. And it's also very anomalous. So trying to really get at these upstream issues so that we don't keep band-aiding. We don't keep, we're doing great things in Flint that I shared, but a lot of this are kind of Band-Aids because we aren't addressing these bigger issues that make it, once again, really hard for people to be healthy and successful.
We're too wealthy a nation to allow this to exist, aren't we?
The most powerful, the richest nation in the world, yet we have millions of children who grow up with no chance of achieving that American promise.
All right. I didn't want to leave it on a down note, but I will say this.
Stop, and we can all be part of these movements to create change. And I once again, I see hope. I see windows of opportunity. And I think more people who care about this stuff, the more good that we will do.
Well, I knew you'd save me there. And I will say this, whatever you do, don't let go of that microphone. You are a national treasure, and you need to keep talking and crusading and fighting this good fight. And I want to thank you for all your service. Dr. Mona Hanna-Attisha, who you may know from Flint, but you're going to keep hearing from her as time goes on, as she continues these important fights about disparities in health. Thank you, Mona, for your time.
Thank you, Miles. It's a privilege to talk to you.